We want to bring in Dr. David Winter from Baylor Scott White Health. Dr. Winter, it's good to see you. You know, the president is 79 years old. Clearly, he's no ordinary patient. We know that. But even with access to the best possible health care, what kind of fight is he facing?
Well, I can tell you clinical studies, Sonya, show that if you start taking Paxlovid early in the course of COVID, you have an 89% chance of not getting serious illness. That's been my personal experience with patients, and so hopefully he falls in that category, and hopefully he will do very well, Sonya.
Now, it's interesting. I've read a lot about Paxlovid. What are some of the side effects? Who can get it and when?
Yeah, it has one annoying side effect, this horrible taste in your mouth. Otherwise, people tolerate it pretty well. I've had no one that stopped it because of that, but that is kind of annoying, we hear. So it takes two things to get Paxlovid. First, you have to qualify. That means you have to be age 50 or older or younger with some co-medical illnesses, diabetes, heart disease, immunocompromised state. So you need a positive test and a doctor's prescription. So if you think that you will need this drug or would benefit from it, call your doctor. They have to call into a pharmacy to get that. It works very well. You got to take it early. If it's after 5 days, it doesn't work quite as well. But this is a nice drug. It's 3 pills twice a day for 5 days. That's all you need to do, Sonya. It works pretty well.
And now with new COVID cases on the rise, I want to get your thoughts again on masks because this debate is heating up once again. Who should wear them? When should we wear them? I'm sort of like half and half on when I grab it and wear it.
Well, first we need to say these things, they do work. They do work to help spread the disease. So if you're vulnerable, you might want to consider wearing it. If you're healthy, but you hang around people that are vulnerable and you don't want to give it to them, you might want to wear it. I've gotten back where I wear these when I'm out in public, in crowded spaces. Indoor settings are reasonable. Otherwise, you can leave it off. But it's up to you with your choice. Do you want to be vulnerable or do you want to go ahead and take a chance? But the masks clearly work.
We should mention, Dr. Winter, that Novavax was approved for use this week. So where does this option fit into the rest of the COVID vaccines that are available to us?
Yeah, it's a welcome addition. So now the 4th vaccine that's out. This one was made in the old way. They take viruses and grow them. They grew these in moss and then take the virus and tear it apart so it's dead and then inject that in a vaccine. And it does work very well. In earlier trials in England, it was 96% effective in preventing serious illness. Now that was back before Omicron. Recent studies down in South Africa where there's BA5, it was 49% effective. Still some benefit there. Now how well it compares head to head, we don't know that yet. I think we're glad to have it, but do we need that instead of the other drugs? No good studies to tell us the answer to that right now.
Yeah, nothing on mixing and matching or boosters yet either. I do want to ask you about monkeypox. Just this morning, we learned that there are more than 180 monkeypox cases reported across the state. 89 of those are here in North Texas. So what you and I have talked about before is this spreads through close contact. What are you telling your patients about prevention at this point?
Yeah, it's become pretty clear. It's close skin-to-skin contact. So if you're out with friends hugging and kissing, if you're not sure, you might want to prevent that. Even handshakes theoretically could spread that. It's highly contagious if somebody has it. And the problem is if they have it, it may take several weeks before they have any symptoms. So we need to be careful right now. Monkeypox out there, it keeps spreading. Vaccines are available if you've had contact with someone who's had it, but they're in very, very short supply now. So your best goal is try to avoid it at all possible.
All right, Dr. David Winter, thank you so much. Good to see you today.